10 medical treatments your doctor probably won't approve. Welcome back to Creepshow, where we dive into the strange, the bizarre, and the downright creepy corners of our world. I'm your host, and today we're venturing into a realm that blends the eerie with the unconventional, medical treatments your doctor probably won't approve of. From ancient practices with a modern twist to dangerous cure-alls that defy science, we've got a list that's sure to make you question everything you know about health and wellness. So sit back, hit that subscribe button, and let's explore these 10 controversial and risky medical treatments. When it comes to medical treatments, the majority of people have faith that their physicians will deliver the highest possible level of care. On the other hand, there is a universe of unusual and controversial therapies that, despite the fact that they are peculiar in nature, continue to garner attention and controversy. There are a number of reasons why these treatments continue to be outside the boundaries of mainstream medicine, despite the fact that they frequently come with big claims and a following of practitioners who are dedicated to them. These treatments are ones that your physician is likely to disapprove of, whether it be because there is a lack of scientific proof, because there is a possibility of danger, or because they are simply silly. A number of these techniques have their origins in conventional medical practices, while others have arisen from the periphery of the community concerned with health and wellness. In spite of the fact that they come from different places, they all have one thing in common. Mainstream medical specialists often advise being against them. In addition to the fact that these treatments are not conventional, the fact that many of them lack the rigorous testing and established benefits that are characteristics of good medical care is another reason why this is the case. For the purpose of this article, we will discuss 10 medical procedures that your physician most likely will not recommend. The activities that are being discussed here are not merely peculiar health advice or harmless home cures. Rather, they are behaviors that have the potential to be risky, contentious, and even dangerous at times. Prepare to fasten your seatbelts as we embark on an adventure into the bizarre and occasionally shocking world of medical treatments that you won't find in the office of your physician. Number 10. Drinking your own urine. The ultimate DIY health hack. The practice of drinking one's own urine, which is often referred to as urine therapy, has a long history and has been pushed by certain individuals as a natural remedy for a broad variety of illnesses, ranging from infections to cancer. Those who support the use of urine assert that it includes beneficial nutrients and antibodies that can strengthen the immune system and detoxify the body. In spite of these audacious assertions, authorities in the medical field caution that there is no scientific proof to support the claims that drinking urine is beneficial to its health. Urine consumption, in point of fact, can result in the ingestion of waste products and poisons that the body has already evacuated, which poses significant hazards to one's cardiovascular health. Urine therapy is still a highly controversial and largely discredited practice in the medical establishment, despite the fact that some cultures and individuals who are interested in alternative medicine continue to advocate it as a cure-all. Urine is primarily a vehicle for the removal of waste materials, which are filtered out by the kidneys, which are an efficient system that the human body has in place through which waste items are removed. Because they are reintroduced into the body through the consumption of urine, there is a possibility that renal damage, infections, and other health concerns will occur. Because it is a health hack, your physician will almost certainly advise you against using it. Number 9. Leech Therapy. Blood-sucking parasites for modern healing. Despite the fact that it may sound like a relic from the Middle Ages, Leech Therapy, also known as Therapy, continues to find a place in contemporary alternative medicine. Individuals who advocate for the use of leeches as a treatment for a wide range of ailments, such as arthritis, migraines, and even cardiovascular disorders, assert that this is possible. In order to perform the treatment, live leeches are applied to the patient's skin, where they attach themselves and draw blood. Anticoagulants and enzymes are found in the saliva of leeches, and it is believed that these substances improve blood circulation and aid in the healing process. Although these claims have been made, the practice continues to be contentious. As a result of the potential for infection and the availability of treatments that are more successful, it is sometimes viewed with skepticism from the medical community. In spite of the fact that leech therapy has historical roots that date back to ancient Egypt and Greece, its rebirth in the modern day is primarily limited to specialized medical diseases and niche circles. A restricted use of leeches in reconstructive surgery has been allowed by the Food and Drug Administration, FDA, to assist in restoring blood flow to injured tissues. Nevertheless, the use of these substances outside of these circumstances is not supported by healthcare specialists. Leech therapy is a treatment that the majority of medical professionals would advise against having because of the possibility of allergic responses and bacterial infections. This is especially true in light of the recent advancements in safer and more dependable medical techniques. Number 8. Ear candling, a smoky solution for earwax woes. A hollow candle made of fabric and beeswax is inserted into the ear canal and then lit. This technique is sometimes referred to as thermal auricular therapy. Ear candling is another name for this treatment. It is believed that the heat and smoke produced by the burning candle will create a vacuum that will draw out earwax and other contaminants from the ear canal. Medical doctors advise against engaging in this activity, despite the fact that it is widely practiced in certain wellness circles. Research has shown that ear candling is not only useless at eliminating earwax, but it also poses substantial hazards, including the possibility of burns, obstructions in the ear canal, and even perforation of the eardrum. Those who advocate for the practice of candling the ears assert that it can effectively treat a wide range of additional health conditions, including sinus infections, headaches, and even an improvement in hearing in general. The statements, however, are not supported by any scientific evidence. Several studies have shown that any debris that is discovered following ear candling is often candle wax and not earwax. Furthermore, the purported advantages are more likely to be the product of the placebo effect than any actual therapeutic activity. The practice of ear candling is severely discouraged by conventional medical advice due to the fact that it has the potential to cause harm, and there is no evidence to support its advantages. If you want to remove earwax, it is recommended that you choose procedures that are both safe and effective, such as utilizing eardrops or going to a healthcare professional. This choice is dangerous and comes with a lot of smoke. It is highly likely that your physician will vehemently disagree with the use of ear candling as a genuine health treatment. Number 7. Cupping therapy, ancient practice with modern celebrity endorsement. Cupping therapy is a traditional method that has its origins in ancient Chinese medicine. It involves applying heated glass or silicone cups to the skin in order to produce a vacuum. It is claimed that this suction will improve blood flow, alleviate muscular tension, and promote general healing. In the past few years, the treatment has had a surge in popularity, which can be attributed in part to sponsorships from prominent athletes and celebrities who display their recognizable circular marks. The scientific data that supports the efficacy of cupping therapy is still limited and inconclusive, despite the fact that it dates back to ancient times and has recently had a renaissance. Numerous illnesses such as chronic pain, respiratory difficulties, and even cellulite are among the conditions that proponents of cupping treatment assert can be treated with the use of this technique. Although the mechanism by which cupping might achieve these effects is not fully understood, numerous studies suggest that the benefits are comparable to those of a placebo. Nevertheless, the benefits of cupping are not completely understood. In addition, critics point out that the cups can occasionally cause discomfort and other difficulties due to the bruising and skin irritation that they create. Cupping is sometimes viewed with skepticism by mainstream medical practitioners due to the absence of substantial clinical proof and the possibility of adverse effects. The technique is widely considered to be an alternative therapy that has not been demonstrated to be effective, despite the fact that there are some people who swear by it. Treatments that are supported by evidence and have been subjected to extensive testing to determine their efficacy and safety are often recommended by medical professionals above more anecdotal approaches such as cupping. Number 6. The use of bee venom in apitherapy, a controversial treatment. The practice of apitherapy, which involves the utilization of bee products such as venom, honey, and royal jelly for therapeutic purposes, has a history that dates back thousands of years. The application of live bee stings to the skin in a regulated manner is the most exciting and contentious component of apitherapy. Bee venom therapy is the most controversial aspect of apitherapy. Bee venom is said to contain components that help alleviate pain, reduce inflammation, and even treat ailments such as arthritis and multiple sclerosis, according to those who advocate for its use. The technique continues to be very controversial among the medical world, despite the fact that it has been around for centuries and has ardent supporters. The amount of scientific study that has been conducted on the efficacy of bee venom therapy is small and is frequently inconclusive. Some research have suggested that there may be potential benefits. However, these studies are typically tiny and lack rigorous methods. The most important thing to note is that bee venom has the potential to trigger severe allergic reactions, including anaphylaxis, which can be quite dangerous. The majority of medical professionals advise against using bee venom therapy due to the hazards involved and the lack of substantial evidence that supports its effectiveness. When it comes to the management of pain and inflammation, safer and more successful treatments are favored. Number 5. Heavy metals that pose a high risk can be removed using chelation therapy. Chelation treatment is a method that involves the administration of a chemical solution, most often EDTA, with the purpose of removing heavy metals from the bloodstream, for example, lead and mercury. In spite of the fact that this treatment is authorized for the treatment of heavy metal toxicity, there are others who believe that it can also be beneficial for those who suffer from heart disease by eliminating calcium deposits from the arteries. The concept behind chelation is that it has the potential to enhance blood flow and clear out arteries that are congested. In spite of this use continues to be very contentious and has not been demonstrated to be effective by conventional medical study. There have been conflicting findings about the effectiveness of chelation therapy for the treatment of heart disease, with the majority of reputable organizations, including the Mayo Clinic, recommending that caution be exercised. It is possible for chelation therapy to cause serious adverse effects, some of which include damage to the kidneys, decreased calcium levels in the blood, and allergic reactions. There is a lack of sufficient data to support the use of the treatment for heart disease or other chronic disorders, and the treatment is dangerous, particularly when it is taken for conditions other than heavy metal poisoning. Chelation therapy is generally not recommended for use in the treatment of heart issues by medical professionals. Instead, they advocate for treatments that are more conventional and have a greater amount of support. Number 4. Coffee. Enemas, a dangerous drink for the purpose of detoxification. In the realm of alternative medicine, coffee enemas, which involve the introduction of coffee into the colon through the rectum, have become more popular as a technique of cleansing the body and enhancing the function of the liver. Caffeine, which is included in coffee, is said to stimulate the liver to remove toxins more effectively, as well as enhance digestion and boost energy levels, according to individuals who advocate for its consumption. However, the majority of these assertions are based on anecdotal evidence, and there is no sufficient scientific data to support the claims that coffee enemas confer health advantages. Despite the fact that this detox procedure is rather popular, qualified medical specialists highly advise against using it because of the enormous hazards it poses to one's health. There is a risk of serious problems resulting from coffee enemas, including but not limited to rectal burns, infections, electrolyte imbalances, and even colitis. It is possible for the native bacterial flora in the colon to be disrupted by the process of introducing a foreign drug into the colon, which can also result in potentially serious side effects. Additionally, there is no solid scientific data to suggest that coffee enemas offer any additional detoxification benefits beyond what the body already performs naturally through the liver and kidneys. It is typically recommended by conventional medicine that coffee enemas not be used for detoxification purposes. This is because the natural detoxification processes of the body are said to be adequate for the maintenance of health. To achieve optimal liver and overall health, it is recommended that one adopts a healthy lifestyle and consumes a diet that is well balanced. Coffee enemas are not likely to be approved by medical professionals as a potential safe or effective health therapy due to the hazards involved and the absence of any proven benefits. Number 3. In the field of wound care, maggot therapy is an unlikely healer. Maggot therapy, also known as larval therapy, is a method of treating wounds that are not healing by digesting dead tissue. This method involves the use of live maggots that have been cleaned. The usefulness of this approach in cleaning chronic wounds, such as diabetic ulcers and pressure sores, has led to a rebirth in contemporary medicine. This practice dates back to ancient times and has undergone a resurgence in modern medicine. The maggots produce enzymes that liquefy dead tissue, which they then consume. This process efficiently cleans the wound and encourages the formation of healthy tissue. The maggots are responsible for this. There are some medical situations in which maggot therapy has been demonstrated to be a useful and cost-effective treatment, despite the fact that it initially has an ick factor. Maggot therapy, on the other hand, is not without its drawbacks and is often reserved for only those instances in which traditional treatments have been unsuccessful. The psychological distress that patients experience is enormous, and there is always the possibility of infection if the maggots are not sterilized in the appropriate manner that is required. Even though the Food and Drug Administration, FDA, has given its blessing to the utilization of maggots for the treatment of some kinds of wounds, the technique is not commonly supported for general use because there are alternative medical therapies that are more widely acknowledged. Before resorting to maggot therapy, the majority of medical professionals will always recommend alternate wound care solutions. Number 2. A dangerous cure-all that is known as miracle mineral solution. There are many that promote miracle mineral solution, MMS, as a panacea that can treat a wide variety of illnesses, ranging from cancer and malaria to autism and HIV. In essence, this solution is a combination of sodium chloride and an acid such as citric acid, which, when combined, results in the formation of chlorine dioxide due to the reaction. It is possible to experience significant adverse effects if you consume chlorine dioxide, which is a powerful industrial bleach. These adverse effects include nausea, vomiting, diarrhea, and dehydration. MMS continues to be marketed in a variety of alternative health circles, frequently with claims that are not supported by existing scientific evidence, despite the risks that are associated with it. Warnings have been made by regulatory authorities such as the Food and Drug Administration, FDA, regarding the dangers of MMS. These warnings underline the fact that MMS is not only useless for treating the ailments that it purports to heal, but it also poses a possible risk to one's life. There have been several complaints of serious adverse reactions and even deaths that have been linked to the consumption of MMS, which have been received by the FDA. The marketing of this medicine as a miracle cure is not only deceptive, but also risky, as it raises the possibility of major health issues for persons who are already vulnerable. Because of the severe hazards to one's health and the absence of any advantages that have been demonstrated, MMS is generally disapproved of by the medical establishment. The vast majority of medical professionals strongly warn against using MMS for any purpose, highlighting the significance of seeking therapies for health concerns that are supported by evidence. It has been established without a reasonable doubt that miracle mineral solution is not a safe nor an effective treatment, and that its utilization ought to be avoided in order to avoid possibly catastrophic outcomes. Number 1. One of the most shocking rituals for good luck is called the baby drop. The shocking tradition known as baby dropping has been carried out in certain regions of India for more than 700 years. The rationale behind this practice is that it bestows good health and good fortune upon infants. As part of this rite, infants are thrown from a height of around 30 to 50 feet off the roofs of temples and land on a cloth that is held by locals below. The majority of people who observe it are members of specific Muslim and Hindu communities. These individuals have faith that the ritual will secure the robust health and prosperous futures of their children. In the state of Karnataka, where it continues to get a substantial amount of attention and controversy, the ceremony is particularly prevalent. The practice has been received with broad condemnation from medical professionals and activists for child safety who highlighted the serious hazards involved. This is despite the fact that the practice has a significant cultural importance. The experts caution that dumping infants from such heights can inflict serious physical and psychological harm, even if the infant is caught in a cloth. As a result of the considerable risk of injury, which may include damage to the brain and problems with development, there is cause for concern over the health and safety of these children. Considering the current state of knowledge regarding the health and safety of children, the practice has been criticized for being one that is both dangerous and out of date. There has been an increase in the number of efforts made to put an end to the baby drop ceremony. Local authorities and human rights organizations are attempting to create awareness among communities about the risks involved and to advocate safer alternatives. On the other hand, the ritual continues to be practiced in many regions because of deeply ingrained cultural beliefs and an aversion to change. It is strongly recommended by the majority of health professionals and advocates for children that this practice be discontinued. They emphasize that the protection of children's health and safety should take precedence over the preservation of traditional customs. That's it for today's deep dive into the world of unconventional medical treatments. I hope you found these as fascinating and alarming as I did. If you enjoyed this video, don't forget to like, share, and subscribe to Creepshow for more content that brings the weird and the wonderful right to your screen. Let me know in the comments below which treatment you found the most shocking, and if there's any bizarre topic you want us to cover next. Until next time, stay curious and stay creepy.